Let this relax.
Wow.
So we have Victor here today. Victor is a brand consultant here in New York City. What do you want to look at today?
Upper back, shoulders, and neck, pretty much. Those are the problem areas.
All right. Where do you notice the neck, for example, like when you're at the computer or sleeping?
Specifically after sleeping.
Okay.
There's a lot of, just feels very jammed
in
the mornings.
Let's try something. We're going to try an arm test. Okay. So hold your arm firm. So this is type of kinesiology or muscle test. So don't let me push it down so easy. Hold your arm up. Make it firm. Stronger. Good. So now we're going to take your head and tilt it to this side. Keep your arm strong, just the same way. And tilt it this way. Good. And tilt it back. And tilt it down. All right, that didn't show anything. So come on and lay down. Let's start on your back. Sometimes the arm will crash.
Oh, okay.
Yeah. And I don't like to fabricate things, but it didn't crash. So the first thing I'm going to do is just find, like, here's a spot. Do you feel that one?
Mm-hmm. Yeah.
All right. So take a big breath in and relax a little bit. And I'm going to make a little adjustment on this spot. You're going to probably hear it pop a little bit. But so I'm lining up. I'm on C2 right now. And let this tilt a little bit. This muscle relaxes.
All right.
How'd that feel?
Good.
Good. All right, let's do the other side, okay? There's one up here, a little higher. Let this relax.
Wow.
It's pretty good, right?
Very good.
Good. So now I'm going to have you lie face down. Now turn your face left and right. You can put your arms down this way. Turn your face to the left and lay it there. And then to the right and lay it down. And which way is it harder to turn, left or right? Or is it pretty loose now that we freed it up?
It's definitely a little bit looser.
Okay, but do you feel any... And point to where you still feel a remnant of tightness. Kind of up in the trap there. Okay, so I'm going to use this face down for a minute. I'm going to use this tapping instrument. I'm going to just tap these last few spots, okay? So this just taps and aligns the bones just a little bit. But I'm specifically going into the muscles right now. So now turn to the right again and see if that changed at all.
Yeah, a lot better.
A lot better. Okay, cool. Let's go down to the legs now, okay? So take this leg lifting from the thigh. So keep the leg straight first and lift this as high as you can. Good. Good. And drop that down and switch legs. Now come to this side. Did one side feel easier or do they feel about even? They look pretty close.
Yeah, right side a little bit.
A right side was harder or
easier a little bit.
Easier. So the left side's more difficult.
A little bit.
Yeah. Visually it looked close, but usually the person doing it could tell you which one felt more of a struggle. So lift this one again and then put that down and lift the right one again and just make sure you like your decision and put it down. So the left one's a little more challenging, correct?
Yeah, I'd say so.
All right. So I'm going to do a few spots and I'm just working into the sacrum a little bit with this tapping instrument called the activator. And I'm also going to come to the top of the iliac crest. Try the left leg again. Any change?
Yeah.
All right, I'm going to do a little bit stronger because I still think I still feel like a little high on this side. So here, look this way so you know what I'm doing. So I'm going to just tap it, okay? Didn't know you were going to do that today, did you? Okay, now try that side. See a difference?
Yeah.
Okay, don't worry, I'm not going to do this around your neck. All right. So now when I bring your legs up like this, I just stepped on the foot pedal. Do you feel any tightness down in here?
Yes.
Point to the spot.
Here, I also did a back workout yesterday. So.
Okay. So he just said he did a back workout yesterday, so he's feeling a little tight there anyway. So the whole posterior chain could be tight from just doing, like, what type of work did you do?
Proper back workout, just
all sorts of pulls,
rows,
or pull types.
deadlifts.
Yeah. So it's good that you're getting a little work done today. So I'm coming into just right of the spinous process, straight down. I'm just loosening some stuff up. And bring this up again. Now, it usually takes a few repetitions till we get this right. So just look for incremental changes. It's starting to loosen up a little in here.
Yeah.
Point to where we still need to go. So sometimes I collaborate a lot, especially like someone like Victor really knows his body. So I might as well lean into that and let him be a part of this visit. If someone has no knowledge of their body, I mostly just start working on him. But he knows his body. He's an athlete and very in tune to his body. So now I'm going to have you lie on your side facing me. We're going to recheck that leg test in 1 second. But I want to loosen you up a little bit more, okay? Because I just saw something that I think might make a difference. So you're going to move your hips as close to the edge as possible. And straighten the bottom leg. So this one goes straight. This one comes up like this. Hold my hand. I'm going to get you off your shoulder. And I'm going to adjust right into where we were just talking about, your lower back, okay? Take a breath in and blow it out. Good. It's already going. Did you feel?
Yeah.
Got it. Come to the other side. So you're going to mirror image to the other side. Bring your pillow with you. Feel good. Feel good, right?
Yeah.
Good. Move close to the side of the table. Pull up just the top knee, and then this arm comes out. And again, we're going to go right into lower back here. One more. That one didn't pop, but I think I got it to move a little bit. So lie face down one more time. And put your nose straight in there. So we're going to bring those legs up again and see if they're starting to feel a little easier in here.
Yes.
What do you think?
Yes.
Where do you still feel it?
Yes, like maybe like here a little bit.
All right, so the next thing we're going to do is I'm going to use a little bit of the Hypervolt in that. That's a massage machine, okay? So you're going to feel that strong massage vibration. Do you feel it?
Yeah. I have one of those.
You do? You like it?
Yeah, I love it.
So this is level 2. How long have you had yours?
3 months now.
3 months.
That's what Kelly and I do.
You just work on each other, right?
Yeah.
That's so good. Yeah. All right, let's try that next. So we're going to bring your legs up again. What do you think now?
Yeah, much better.
Okay, so now lie on your back. You're going to come closer to this edge of the table because the table's pretty wide. Yeah, perfect. And keep your knees bent like that. That's nice. Yeah. Now, I remember you told me before that your ribs hurt a little bit. So this is going to probably... Now, his ribs are all the way back from when he was 12 years old. So this is not like an acute rib situation where he's bruised or tender. I already looked at the skin around the ribs. They're fine. And you've had it for years, right? Just that achiness. So we talked a lot about stretching for the ribs. I like hanging from a chin bar. But if your feet touch, you can just do one arm at a time and really start to work your ribs and stretch and kind of dangle and find angles to open this up. In his case, I think that's going to get him the most mileage, but this adjustment will also loosen up that area quite a bit. So I'm going to put my hand underneath. You feel those? Good. So now get into the center of the table and stay on your back. And I'm just going to stretch these legs straight. You can drop your head. Yeah, I'm just going to pull down here a little bit. Good. So come stand on this side of the table and see how you feel. And stand right there. Move around a little bit. See how your neck feels. What do you think?
Pretty loose.
Yeah, it's good, right?
Yeah, it's great.
All right, cool. Thanks for coming today. Appreciate it.
Thank you.
Thank